So today is September 24th, about 2.5 weeks post nasal reconstructive surgery with a rib graft, and that was to repair a collapsed septum and nasal deformity that resulted from the extubation that was at the end of my double jaw advancement surgery for a restricted airway and sleep apnea. So I'm almost 6 months out from that, and 2.5 weeks out from the nose surgery. They also did plastic surgery to repair the look of my nose to make it look a lot closer to what it did before. It's still quite a bit inflamed, but I will tell you that when you compare this to the other videos, I'm very pleased with the look. My upper lip is very stiff still. It's hard to show my top teeth. I had another incision along my upper lip, almost as long as the original, because they did an incision as part of the surgery to remove 2 of the plates and 10 of the titanium screws on my upper jaw that were really kind of like not doing well with the tissues and around my sinuses, which were contributing to the nasal issues. So I've got to recover from that incision. I did remove the stitches myself because the knots were starting to bother me. They were dissolvable stitches, so I snipped the side of each knot and pulled the stitch out myself, which was good. I feel much better, but I had to recover. My lip has to recover just like it did last time. The bones of my face, after I went off all the Tylenol and the pain meds, I can feel like have to heal from where the plates and the screws were, and that just has to, I guess, fill in with fresh blood and then turning into the calcium deposits and scar tissue, I assume. And so the nose is going to be swollen for quite some time, but it looks better already, and hopefully as the inflammation on the inside goes down, I'll be able to breathe better out of my nose and out of my mouth, which will be good. I'm sleeping much better overall, since the double jaw advancement, and now when my nose gets better, it's only going to be better. I still have some significant discomfort with the rib graft because they did an incision right through my abdomen wall rather than spread the abs, which I'm not psyched about at my age, or be at any age in my activity level, but I'm going to have to deal with that. The bone still takes 6 weeks to heal anyway, so it's not like I'd be able to do anything, but it is hard to get up and down and in and out of cars and things like that because of how much you engage your core. As far as the jaw goes, my upper teeth hurt a lot this week, and my gums and upper jaw hurt quite a bit from the removal of the plates and screws. I believe that's why it was sore. My bottom jaw and teeth are still the same. There's some numbness on part of my gum. There's feeling on another part of my gum. My bottom lip and my bottom jaw and chin are still tingly, like the nerves are coming back. That's going to stay that way for, I guess, another couple of months. And then I'll kind of have a better indication of what kind of feeling I'm going to get back, if any. It could be like this, or it could completely revert back. The stiffness in my upper lip is a challenge, only in that I can't really massage it or do facial exercises to get my smile back and my facial expressions back, and see my upper teeth like normal because of the nose. Like, I've got to let that be still for a while for it to heal, because they basically rebuilt the inside of my nose with rib and rib cartilage. So I've got to just kind of let that go, and once the nose is maybe more secure and firmed up and healed and the swelling goes down, then I can start to get my facial muscles back. The lisp is still there that I have developed from the surgery, and the nasal sound is still there because of the inflammation, but hopefully the nasal sound goes out of my voice, and as soon as my lips can get more pliable and I can recondition the muscles in my face, then hopefully the lisp that I've developed and the need to really enunciate so that people can hear me, because I do tend to trail off when my face gets tired, hopefully that will go away as well as the swelling in my nose comes down. So again, 6 months from the surgery. The total recovery time is typically 9 to 12 months, but I'm 12 to 18 months for my nose surgery with the rib graft and the nasal reconstruction. So that's completely sort of done. So Most of the swelling, probably 70%, will be gone after 2 months. It's been 2 weeks. And then it could take up to 2 years to get the final definition of what my nose is really going to look like. But right now, I'll take what I have. I'm pleased with it. You know, the tip is swollen, but that's okay. It still looks a lot better than it did for the last 5 months. So, so far so good. I'm hopeful that everything heals on track and on time. And, you know, that's the update for today. And I will be checking in soon. I plan to release everything on the 6-month anniversary of the surgery. And that will be, I guess, next week. So I'm going to try to clip it all together in an editor, video editor, and with all the pre and after and before, after, and during recovery pictures of inflammation on the jaw.